Good morning, everyone. I am Yolanda McBride, the Director of Public Policy at Children's Aid. On behalf of the Foster Youth Success Alliance, or FYSA as we're known, I thank you for joining us this morning. Today's presentation is the last in a series of 4 webinars focused on understanding and addressing the priority needs of New York's foster youth in the aftermath of the COVID-19 health crisis. During each webinar, we share findings from a pandemic impact survey of New York's older youth from foster care. We also spotlight priorities and policy recommendations that address both pre- and post-pandemic issues of concern for young people with a foster care background across the state. Our goal is to improve their stability and expand support to ensure every young person from foster care is ready to move forward in a positive direction. To give context to the survey findings, FYSA has prepared a report entitled Moving Forward, a Post-Pandemic Blueprint for New York's foster youth. The report link is in the chat, and we ask that you please bookmark this link for future reference. Before we begin, I'd like to recognize the Children's Aid Office of Performance Management, CAFCA, and the Schuyler Center for Analysis and Advocacy for developing the New York State Foster Youth COVID-19 Impact Study. We especially want to acknowledge the 209 young people who responded to our survey. We know that so many foster youth showed tremendous courage and resilience during this challenging time. We also know we have to do more to give each of them the stabilizing supports they need. Finally, I'd like to thank the many FYSA partners and youth advocates who helped identify the healthcare priorities and recommendations we will share with you today. So some housekeeping. Let's go over a few tips. Everyone is in listen-only mode. If you have questions, we ask that you please use the Q&A feature. We will monitor the questions and address them at the end of this presentation. Again, we ask that you please use the Q&A feature. This presentation is being recorded and will be available on the FYSA website afterwards. Now let's quickly review the agenda. Today we are focusing on healthcare. The pandemic certainly created a host of new medical and behavioral health issues for people across the board. Our primary concern is the added burden a public health emergency placed on many youth in foster care who are already trying to heal from previous childhood trauma. This is why we must act now to remove healthcare barriers and support policies that give these youth everything they need to be healthy and thrive. Let's look at our agenda for today's session. We will provide some background about FYSA, give you an overview of the Moving Forward report, and share study findings and foster youth reflections about their pandemic experiences. We also have a few issue experts with us today who will share their perspectives about the healthcare priorities and recommendations featured in this report. Finally, we will leave some time to take your questions at the end of the presentation. Now I'd like to introduce Deidre Nesbitt, the new director of the Fostering Youth Success Alliance, to share a little bit about our mission and take us through the COVID-19 impact study findings about healthcare.
Thanks so much, Yolanda. So I'm just going to introduce you a little bit to the Fostering Youth Success Alliance, or FYSA as we're known. Launched in 2014 and we're housed at Children's Aid. FYSA promotes responsive policies and programs that offer young people with a foster care background every opportunity to set higher expectations and achieve their goals. We do this by collaborating and partnering with city and state agencies, advocates, and stakeholders directly impacted by the foster care system, including foster youth, parents, and caretakers, to address system reform. We focus on our policy and advocacy work on the socioeconomic issues that impact youth with a foster care background, including K-12 education, higher education, housing, and health. Our signature initiative is the Foster Youth College Success Initiative, which is administered by the New York State Education Department. To date, $34 million has been invested into the initiative. Since launching in 2015, the Foster Youth College Success Initiative has served over 2,000 students with a foster care background at 100 public and private colleges and universities in New York State. FYSA also provides opportunities to support foster youth empowerment and the development of advocacy skills through several programs as events, as you see on the slide. So now let's take a look at the study background. The New York Foster Youth COVID-19 Impact Study was structured based on a survey conducted by Foster Club during the early stages of the pandemic. We wanted to follow up about a year later to see how the public health crisis was affecting New York's older foster youth, including young adults that have transitioned from the system. Our study questions were very similar to the national survey, with modifications to reflect the New York State context. Our targeted age group was 18 to 26. We distributed the survey through both upstate and downstate partners, and were able to collect responses from 209 young people. Similar to the Foster Club study, we asked foster youth about issues and concerns related to living through a major public health crisis. Please refer to the study background of the section of the report for demographics and additional information about the survey respondents. The link for this section is in the chat. Now let's take a look inside the report. So let's review how the report is organized. On the screen here, you see our table of contents page. We have our executive summary, study background, a little bit about FYSA, and then our 3 policy briefs. Each feature key survey findings and address specific and significant pre- and post-pandemic issues related to housing, education, and healthcare for the state's foster youth. Today, we're focused on healthcare. So on to the healthcare policy brief. Just a reminder to please use the Q&A box instead of the chat box to submit your questions. It just makes it easier for us to organize them. So let's look at the findings from the New York State Foster Youth COVID-19 Impact Study related to healthcare. As COVID-19 cases overloaded New York's healthcare system, most survey respondents weathered the storm. However, some youth from foster care reported unmet medical and behavioral health needs, access issues, and a lack of clarity about their insurance status. Gaps in healthcare can intensify pre-existing conditions for youth with a foster care background. Many have suffered prior trauma that has compromised their physical and emotional well-being. Although some of these young people may know about available healthcare resources, they often need more support navigating eligibility requirements, arranging appointments, and securing the pre-authorizations they need to resolve their health issues. So a lot of foster youth were left with the question of where do you turn when the healthcare system is on pause? As coronavirus cases surged, clinical practices across New York shut down. Many healthcare providers and hospitals would only accept patients with life-threatening conditions, making it hard to book in-person appointments for preventive and non-emergency health services, such as dental care. During this time, the expansion of telehealth services connected some patients to behavioral and medical providers when in-person visits were no longer safe or available. Sharing some findings, we found that 11% of respondents had trouble accessing mental health services. Even before the pandemic hit, young people with a foster care background often required ongoing behavioral health support to assist their recovery from acute childhood trauma. While some youth benefited from online therapy during the pandemic, others found it more difficult to seek professional help during an emotionally vulnerable time. 63% of respondents, nearly 2/3, suffered from heightened anxiety. This elevated stress likely relates to fear of catching the virus, increased social isolation, job loss, remote learning pressures, food insecurity, and housing instability. We saw that 64% of the respondents who reported unmet medical or mental health needs are living on their own. Their independent young adults were most likely to have trouble accessing care than those residing in college dorms with foster families, in group homes, or in residential treatment centers where wraparound health services and care coordination are more accessible. 73% of those who reported unmet health needs identified as women. 23% of respondents said healthcare is a priority concern for the next 6 months. We saw that nearly 20% of survey respondents said they were either unsure about their insurance status or mistakenly thought they didn't have coverage. This misconception is troubling as it may cause delays in seeking medical attention. In New York, all current and former foster youth are eligible for Medicaid. Child welfare agencies typically coordinate health insurance matters for youth in the system. After they leave foster care, young people are issued their own Medicaid card, which provides coverage until they reach age 26. Here we'll see some youth reflections from young people focused on how COVID-19 affected their healthcare. We saw some young people say, I can't always afford the copays with my insurance. I'm supposed to have health insurance from my job, but I didn't meet the deadline. I'm experiencing an increase in health problems. It's been stressful to not know entirely what the insurance we are given uncovers until it's too late. Here we see some more survey respondent comments. I have transitional Medicaid. Many places don't accept it, and if they do, the service is terrible. I was kicked off of insurance under my old guardian's name and have been without insurance for almost a year now. Remote therapy has been a lifesaver for me. It should be available to all foster youth, not just those with a job who can afford it. Now let's take a look at the healthcare policy priorities and recommendations from the Moving Forward Blueprint. A reminder that you can view the report online by clicking the link in the chat box. So here's our first recommendation. Create educational materials to produce information regarding health insurance coverage to current and transition age foster youth. New York State is in the midst of reforming healthcare delivery for foster youth, including a shift to Medicaid managed care. All foster youth will automatically be enrolled in this plan and receive a new insurance card. The state should work to develop educational materials to help current and transition age foster youth understand their insurance coverage. Next recommendation. Increase transitional supports to help older youth leaving foster care better manage their healthcare on their own. As young people prepare to exit foster care, they may be preoccupied with other priorities, such as securing housing, finding employment, and focusing on school. The state should offer at least 12 months of transitional support. For instance, check-ins, workshops, navigation assistance, to help older youth manage their medical and behavioral health needs. Our next recommendation is to extend eligibility for the Medicaid Health Homes program to include current and former foster youth up to age 26. The Health Homes program was created to improve healthcare coordination for Medicaid enrollees with chronic conditions. All youth up to age 21 are currently eligible for this program. At age 21, the criteria for adult health homes become more stringent and does not account for the unique needs of young people with a foster care background. Our next recommendation is to advocate for Medicaid reimbursement rate increases to maintain and expand telehealth services. Currently, Medicaid reimburses providers at a reduced rate for video and phone appointments covering a wide array of services, including behavioral health. Telehealth options are essential for many foster youth as they typically face significant access barriers with seeking in-person care. Rate parity for remote services would have a meaningful impact on protecting the emotional and physical health for this population. This next recommendation is to change the Medicaid threshold rule to make it easier for providers to deliver comprehensive and convenient care to patients. Currently, Medicaid pays for a single service per visit. For example, when a patient comes to a clinic planning to see multiple health practitioners during the same visit, i.e. dental, behavioral health, medical, all in one visit, the clinic can only bill Medicaid for one service. A carve-out or waiver from the Medicaid threshold rule would help minimize common healthcare access issues experienced by foster youth and ensure they receive the care they need in a timely manner. So next up, I'd like to invite our special guests to share their perspectives about FYSA's healthcare priorities and recommendations. We're going to start with Timothy Hathaway. Timothy Hathaway is the Executive Director of Prevent Child Abuse New York, a statewide organization dedicated to building strong families through training, technical assistance, and advocacy designed to change systems that impact child maltreatment. Tim has over 30 years of experience working with children and families and the systems that serve them. Previously, he served on the Federal Head Start Technical Assistance Team and directed Head Start, Early Head Start, and child care programs in various states. So now I hand it over to you, Timothy.
Thank you so much. I appreciate it, Deirdre. And thank you to everybody who's part of this call today. Wonderful topic and fantastic report. So I'm glad to have an opportunity to talk with you just a little bit. For my comments, I'm interested in addressing the need for young people to access healthcare to really heal from trauma they may have experienced in their lives earlier and in childhood. And this is referenced in the report that oftentimes this group of kids really has had a background of exposure to some types of trauma. I would like to start by offering up this data piece. This is from a report that was released in 2014, and it indicates that children who were identified as maltreated or being at risk of child maltreatment incurred on average Medicaid expenditures that were $2,600 higher per year compared to children that were not identified. So I want to pause there and let that sink in for folks, that for the population of kids who have exposure to trauma, $2,600 per year of additional Medicaid expenditures. So we're talking about a population of kids who, on average, is very much more likely to need access to healthcare services on a regular and easy basis. And so I think that statistic in and of itself really highlights the critical nature of what this report is bringing forward, and helps us to kind of frame how really impactful this issue is for kids. There is a persistent and unhelpful modern myth out there that health and mental health are separate somehow, that we have created systems oftentimes that split those things apart, but our bodies don't see it that way, right? Our bodies don't split out what's happening for us emotionally all the time and what's happening for us physically. We're impacted. Those things cross each other all the time in our day-to-day experience. And so for kids to, and for all of us really, to heal emotionally, we need to have that opportunity to heal physically as well. It's a critical piece of whole health, of being a whole person. And so how does that happen? You know, what are the things that need to come together in order for that healing to happen? In the work that we do at Prevent Child Abuse, we talk a lot about the environment that needs to be in place for kids to be strong and to be healthy and to be well. And so we talk a lot about, first of all, about relationship, that kids need to be in relationship with caring, strong adults. And this study, I think, really highlights that. You know, we hear that healthcare is a place where a particular relationship, an important relationship to kids, happens, and it's a spot that we can promote relationship not only to those other people that are caring for us in the community, but also to the broader community that's around us. So relationship is an aspect. Knowledge and self-awareness is another piece that we talk a lot about in terms of the environment that needs to exist for kids. And so again, when we think about this work around connecting kids to stable healthcare and easily being able to access that, I think one of the places that we learn about ourselves, we learn about how we can improve what we're doing, how we can be more in tune with our bodies, how we can take the next step to recovery and health is through this knowledge and self-awareness piece. And so that having that piece in place, making access easy for kids is critical to that. Another element we talk about in terms of this environment for healing is this access to real help when it is needed. And so what does that mean? We're talking about real help like transportation. Can I get to my medical provider? I love the fact that telehealth is included in this. I think it's a critical piece because it really does help get help when needed. Medicine. I spoke with somebody just the other day who had a issue with getting a medicine corrected and the difficult struggle they had with getting to their physician, being able to just get that simple medication, but they needed that medication to help manage pain. Physical therapy, a whole host of things that are real help when they're needed. And this study is bringing that to light. And then the final thing that we talk about is this issue of resilience. So being able to get back up after you've been knocked down, and as importantly, being able to really grow from the experiences that you've had. And when we have healthcare in place, it supports that sort of resilience in some really, really critical ways. So thinking about that, when we know that we have youth who are impacted by trauma, putting in place this environment of a real sense that they have an opportunity to heal. This study in particular really is cueing in on that. The recommendations specifically that address educational materials, I think, are very, very important. Sometimes, sometimes we hear about recommendations that come forward to provide additional resources and material, and that feels like, oh yeah, well that makes a lot of sense. Well, what we know is in this case, it really does make a lot of sense because when kids who have these experiences do not understand, we know that their tendency, because of the trauma, is to get further and further out of the loop. Often withdrawing or responding emotionally with a lot of anger. So making sure that kids are well informed is critical to this effort. This piece about increasing transitional supports, again, it's phenomenal that we see this again and again and again in our work, that those points when stress is elevated in the life of all of us, and we all know what it's like to face change. But when stress is elevated through those change pieces in our life, those are moments when we make choices often that drive us one direction or another direction. Having these additional supports for transition are really, really critical. And then extended eligibility, of course, is the way that we make access really live and a real thing for this population. So I want to turn from those comments. I'll take just a minute or two more because I also want to highlight this issue. I think it's inherent in what the report is addressing, but I know that from our work, the issue of having a ready workforce in place is critical. And we all know that there are shortages across the health delivery system, and that there are major challenges in the health delivery system. What we know also is that when healthcare providers have real knowledge about trauma-informed practice, about adverse childhood experiences, they will provide better service to their patients. And oftentimes, we see that the workforce does not have information about trauma-informed practice. They do not know how to translate trauma-informed practice into what they're seeing. So maybe they know about it, but they really don't know, how do I do this? So if I'm a youth walking into my doctor's office and I'm picking up that vibe that this is not a place that cares about me, and worst case scenario, I feel triggered by what's happening in that environment, that's not going to help me. And so I think there's a simple fix that we can focus on. And again, I think it's right in line with what this report is bringing forward. With that, I'll just say thank you again. Pleasure to be here, and anxious to hear the other comments.
Thank you so much, Timothy. We really appreciate your insights and really sharing about what's needed to help young people heal from the trauma that they may have experienced in a meaningful way. So next up, I would like to welcome Rosita Medence to speak a little bit to the experiences that she's had working with foster care youth in our communities. She is the Senior Social Worker for Foster Care Mental Health at Children's Aid Bronx Health Services. She's a licensed therapist who has been working at Children's Aid since 2017. As a therapist, she provides mental health services to children and adolescents, working primarily with youth in foster care. Rosita obtained her Master's of Social Work from the Silberman School of Social Work at Hunter College with a focus on clinical practice with individuals, families, and groups. And she's excited to share about her experiences. Welcome, Rosita.
Thank you, and good morning, everyone. So as you heard, my name is Rosita Medence, and I am the Senior Social Worker here at Children's Aid Bronx Health Services. At our agency, we currently service both community clients as well as foster care youth, including those that are no longer in care until the age of 21. And we ensure that when they are aging out of services, that they are connected to other providers as well. I'm excited to be here listening to the amazing work that is currently being done in an effort to better support our youth in foster care. I wanted to take this opportunity to share about some of my experiences as a therapist working directly with youth in care, especially throughout the pandemic. During this time, although I know that we've all struggled, I know that it's also been especially difficult for our foster care youth who oftentimes may not have had the same access to external supports, whether that's family or friend supports, or as well as just access to adequate resources in general. And as we already know, our youth in care often experience complex traumas throughout their life in general that impact their functioning in the day-to-day. What I have found in my work with clients is that it seems that throughout this pandemic, these trauma symptoms have been exacerbated and worsened throughout the pandemic. The challenges that many of the adolescents that I've worked with have reported to me have included feelings of isolation. So throughout the pandemic, they weren't able to go out as much or spend time with friends or go to school, socialize with others. Those things that, especially as a teen, is really important to their life. And those feelings of isolation and loneliness have had a great impact on them. As we've already heard today as well, there's feelings of anxiety and fear. So the teens that I've worked with have often reported anxiety, not only related to fear or worry around the virus itself, but also fear for loved ones, anxiety around re-entering society as things are slowly starting to open up, and anxiety related to how the pandemic itself has changed the course of their lives in many ways. They've also reported a lot of feelings of grief. So many of the clients that I've worked with have expressed grief not only because Many of them have lost loved ones, but grief also related to what they've lost throughout the last 2 years. So things that maybe we may not find significant, but for them, right, in this course of their lives are really important to them. And things such as losing out on graduations or trips, time with their friends. A lot of the teens, especially the ones that I've seen and worked with my clients, are at a stage in their life where they were going to go on to college and they were just, starting their senior year and excited about all of the experiences that come with that and the grief of not being able to have those experiences that they worked so hard to obtain. And along with all of this, has led to a lot of feelings of depression as well. So being isolated from their peers, feeling lonely, struggling to find that support has led to an increase in their depressive symptoms as well. And as we're discussing around the challenges that they're currently facing and have faced throughout the last few years, there's also another aspect of the discussion that I do feel is important to mention as well, which is that because of the pandemic, we have had to become more creative in the way that we're approaching our teens and engaging with them, especially when they're not able to attend in-person sessions. And what I found is that throughout the course of the pandemic, we were able to continue to offer support and sessions without a lapse in services through implementing telehealth services. And for the most part, the majority of the teens that I've worked with have responded really well to telehealth sessions. And in my discussions with clients, they've expressed that because of the access to telehealth services, they're happy that they're able to have sessions from the comfort of their own homes. Oftentimes that's where they do feel the most safe and comfortable, and being able to be there while discussing around some of these things that they're struggling with has been very helpful for them. Telehealth has also offered them more flexibility. So for a number of reasons, clients may have struggled with coming to sessions in person, whether that has to do with their depressive symptoms or not feeling motivated to leave their homes. And now they have access to these services in a way that they weren't able to have them before. It's also allowed for a lot of our older teens as well, who are maybe working to support themselves. It gave them the opportunity to engage in sessions in a schedule that better works for them. So for clients who maybe before weren't able to engage because they had work, and now they're able to maybe have a session on their lunch break without the worry of having to travel to the clinic. And it's given us the unique opportunity to interact with clients in their natural spaces, and sometimes to see some of the relationship dynamics or the interactions that maybe before we weren't able to see when they were in the office. And it's provided us the opportunity to offer more support in real time. So in moments of stress or crises, my clients have expressed that they found that it's been easier to reach out to support and have sessions over phone or via video without having to wait to maybe come to the clinic to make an appointment. Or for example, if a client is struggling with anxiety and is having panic attacks when they're outside, it's given us the ability to be a little bit more creative in the way that we're working with them. And so maybe they can have a session in a park that's near their home where we can practice mindfulness exercises together in a way that wouldn't have been possible before. And I think that although of course, there have been many challenges related to implementing telehealth. I found that the majority of my teens have been increasingly more engaged in services and consistent in their attendance. So teens who before have struggled to make it to their sessions on time or attend at all, now they're logged in every day and engaged every week. And sometimes, coming in earlier than their sessions, just waiting for their session to start. And I think it's been a really big gift to the clients to be able to have this access that maybe before they were really struggling to get. And of course, for all the clients that we have served and are currently serving, there are still much more who are in need of support and mental health services. And I think that's why the work that has currently been done in terms of trying to figure out what other support and access we can give to clients, how we can make things more clear to them and present information to them in a way that they'll be able to access more services is really important. I believe that what the last few years have shown us is that there's not just one way to engage our clients, and using telehealth has opened a lot of doors in making mental health treatment more accessible and allowing us the opportunity to find more creative ways to engage our clients in sessions. And I am excited to see how we continue to find new ways to engage and meet the needs of all of our clients so that they're all able to access the mental health services that they might need. Thank you.
Thank you so much, Rosita, for sharing a little bit about what your experience has been working with young people, and about how we can make the service more accessible so that young people can get support through their mental health needs. I want to turn it over next to Julia Pichardo. Julia Pichardo is the Director of Foster Care and Mental Health at Children's Aid Bronx Health Services. She's a licensed clinical social worker who's been working at Children's Aid since 2015. Julia has a passion for working with foster care children and youth and serves as an advocate for this population through her work as a social worker and director. Julia obtained her Master's of Social Work from the Silverman School of Social Work at Hunter College with a focus on clinical practice with individuals, families, and groups. And now I turn it over to you, Julia.
Thank you, Deidre. It's an honor to be here. Good morning, everyone. As she mentioned, my name is Julia, and I'm the Director of Foster Care Mental Health at Children's Aid, and I oversee the therapists, our social workers, in providing the direct clinical practice. And I provide clinical guidance and support to all of our social workers, as well as advocate for any barriers and try to overcome any barriers that they are having or that the clients are having, and helping them problem solve any challenges that they're having. And today I wanted to talk a little bit about the barriers to accessing mental health, which have been mentioned before, including having to find a provider, having to kind of deal with the insurance, having to go somewhere for mental health services. And another big challenge that I noticed in my previous work, in my ongoing work with this population, as well as with other clients, is the knowledge of when to seek help. How do you know when you should be going to therapy or trying to find someone to talk to? That's really hard to find, especially if you haven't had a therapist before, or haven't been able to engage with someone, or just don't have the knowledge base about what mental health is, about what therapy looks like. So I just wanted to kind of give an overview today about what should we be looking out for? When should someone seek help for mental health reasons? And as Rosita mentioned, a lot of these concerns or symptoms that a lot of our children experience or teens experience are around anxiety, depression. I'll go into each of them a little bit more. In terms of anxiety, some teens or children experience panic attacks or generalized worry about the day-to-day, not just about COVID and their safety, but also this anxiety kind of spreads to other parts of their life, including school, eating, their friendships, worry about themselves, about being able to succeed, about doing things that they were able to do before. Also avoiding places or different settings, right? I think with COVID, we all became extremely anxious about being outside or socializing with other people. But as things start opening up, that anxiety can continue and get in the way of doing things that you normally enjoy doing, or things that you have to get done, like going to work, going to school. So we find that, that's something to look out for. If you're avoiding different places or settings and this anxiety is just not going down, it's really getting in the way of you doing things that you normally would need to do or would like to do. As well as ongoing concerns, about your safety and the safety of loved ones. Not that this is not normal to experience, but when that's kind of all that you're thinking about constantly, it can become detrimental to your mental health and your overall functioning. Also, other symptoms of depression in terms of like feeling really isolated, feeling like you're not connecting with people. Even if you have those outlets that you're just not reaching out, you're not socializing with your friends or family, feeling really tired all the time, feeling really unmotivated, feeling numb, Depression is not just about feeling sad all the time. It can also present itself as irritability, feeling numb, not being able to experience happiness or experience other feelings. You're just kind of, you're not even sure what you may be feeling sometimes. Being able to engage in activities that you used to like before, not being able to do that anymore, like different hobbies like journaling, or you used to like taking walks, or going to the movies, different activities or hobbies that you used to enjoy. You're noticing that you're not doing any of that before. Feeling hopeless about the future, about yourself, about some of the goals that you may have. Those may be some symptoms or concerns to look out for. As Rosita mentioned, feelings of loss and grief in terms of yourself, your family, kind of the world in general, feeling really hopeless about how things have kind of turned out. You're noticing that you're having difficulty focusing, which maybe you weren't experiencing before. You're just really distracted. You cannot complete a task that you're working on, especially with school or with work. You're just having a really hard time getting yourself focused and completing that task. And that's really getting in the way of your overall functioning in the day-to-day. Any difficulty sleeping, you may be experiencing nightmares, or you're just laying in bed for hours, not being able to sleep. If you're ever experiencing any thoughts of hurting yourself or hurting other people, or, you know, kind of wondering why you're here, kind of what your purpose is. Those are all good reasons, you know, to seek out and try to speak to someone or seek mental health services. Also, if you're not doing well academically or with your job, you're constantly getting in trouble, or you forget to do certain tasks, and that may be getting in the way of you being successful at whatever you're trying to accomplish. Those may also be reasons why maybe getting some help may be beneficial to you. And another barrier that I've also found is that we may not know what therapy looks like, right? And that may be a big barrier to accessing help. Maybe you feel like you need to know what your concerns are, or what you're hoping to accomplish, or, you know, you have this pressure of like knowing what to say when you go to speak to a counselor. So I just wanted to kind of bring a little bit of kind of insight about what therapy looks like. And of course, definitely you don't always need to know what to say. We're here to help you and facilitate those discussions through very like informal and formal ways of gathering information. So we'll complete assessments in the early stages of therapy, engage in conversations and discussions about what's been going on, exploring some of these symptoms or challenges that I discussed before, and can help you kind of identify what those challenges are and what's getting in the way of your day-to-day and your overall functioning. Once we identify what those concerns and challenges are, then we will help you identify what your goals are, together collaborating from what we're observing, from some of those assessments that we complete, as well as what you're sharing with us that may be important for you to work on. And together we create a treatment plan, and identify goals and objectives that we want to help you work on. And that's a process that is kind of ongoing. Whatever you came in today, maybe that's resolved or no longer as important as other concerns that may be identified. So we definitely continue reviewing regularly with the clients what their goals are and what the challenges are and what progress is being made towards treatment goals and whatever we're working on in therapy. And then we will also help you learn different strategies and skills to address those goals and address those challenges. So that's also an ongoing process. And we, again, assess regularly how those skills that you're working on are helping you or not, and try to find alternative skills and then interventions that may be helpful to you. And finally, just wanted to share a little bit about confidentiality. All of the information that we share with you, or that you share with us, remains confidential. And I know that can be hard sometimes. Can be a barrier to some of our teens. So they feel like we may be talking to people in their foster care team, or other providers, or other caregivers, or anyone that's involved in their life. But it's really helpful to know that anything that we discuss during our therapy sessions remains confidential, unless we have concerns about safety, and then that's when we will discuss that with you if we have to share with anyone else. But aside from that, all the conversations that we have remain confidential. And I really try to ensure that all of our therapists are providing the best work that they can through my clinical supervision with them, and really trying to discuss with the therapist what their challenges are in connecting with the teens. Sometimes that can be difficult to engage with a specific therapist or with a specific client. So we really try to overcome that and work around some of that and help them problem solve. But with that being said, I really hope that this was helpful in understanding a little bit about when you should seek help and trying to overcome some of these barriers that have come up and that have been addressed earlier in our presentation. Again, thank you for having me, and please feel free to ask any questions that you may have.
Thank you so much, Julia. We really appreciate you shedding a little light on what can be the barriers to really being able to access support when it is needed. So now we want to give you a little bit of time to be able to post any questions that you may have in the Q&A. As we do that, we are going to launch a poll. We ask you to please complete the short poll that's about to pop up on the screen. Okay, so now let's take a few of your questions. Chelsea, would you like to please share the first question?
Yes, so the first question, how can we support youth in finding mental health providers?
I can respond to that. So there are easily accessible online websites that you can find information for mental health providers, including NYC Well, where you can put your zip code and whatever your needs are, and they'll give you a whole list of all providers that are in your area or that are available, as well as providing information about in-person sessions or telehealth sessions. We're also able to identify providers through other portals, which I can provide the links on the chat. But also any foster care agency that you're working with, that you are a part of, they can also help connect you to providers that can provide mental health services for you.
Great. And the next question is, can you share some strategies to encourage youth to seek mental health support?
Rosita, I'm curious. Oh, I'm sorry, Timothy.
Yeah, this is Tim, and I would just jump into try and respond to that question about how to encourage youth. And I'd love to hear some of the practitioners' responses to that too. I don't want to put them on the spot, but I know that one of the things that we talk so much about is really being in a spot to to listen and offer authentic relationship to kids. So we do some work with a group here in the Capital District who connects with a lot of kids who are struggling and tries to do some art therapy kind of work with them. But we were meeting the other day, and one of the things that they talked about is this idea that their ability to meet kids with just authenticity, it really has been a critical factor in helping guide those kids. So I talked about a little bit earlier about this issue of relationship, and when we're in crisis, when we're struggling, we're looking for people that we have relationship with, that we can depend on, and so that to me is always a great place to start. But again, I'm toss it over to other people who have comments.
Does anyone have anything else to say on that question?
I can share a little bit. This is Rosita. So I think that in terms of, engagement with clients, I know that at times it can be very difficult when someone isn't necessarily sure whether or not therapy is for them. I think that definitely meeting a client where they're at and really trying to explore what might be going on and anything that they might be struggling with, I think is a really good place to start, just in terms of helping them to see and maybe understand how these recent events or recent stressors have been impacting their lives. I also think that really focusing and maybe engaging them through their interests. So as Timothy mentioned, art therapy, or finding some ways to really get them to want to be involved through things that they are already interested. I know as the therapist, by the time they come to me, they kind of already, understand that we're going to be starting sessions, and my job is kind of just to keep them engaged. And so what I like to do with clients as well is really sitting with them and helping them identify things that they may want to work on, and really taking a step back and letting them be the lead in what they feel is important to them. I think oftentimes, especially our youth in care, struggle with feeling like people are speaking for them or trying to tell them what they need. And by giving them a space where they're able to really share what they want to work on, it oftentimes helps them to feel a little bit more engaged and willing to participate in sessions.
Great, thank you. And it also looks like Julia put some resources in the chat, so take a look there for further explanation. Our next question is, a lack of access to technology an obstacle to participating in telehealth, and how can we mitigate that?
So I can share a little bit. So we definitely try to promote video sessions during at least the mental health services that we provide. But we definitely provide phone sessions as well for clients that just do not have access to video. But we also try to explore those barriers in terms of accessing video, or using Zoom or using other platforms that we may use, and really try to problem solve with the client on trying to get that set up and having some, kind of trial runs and trying to make it work. But we also do provide phone sessions. And I know that the other providers provide phone sessions as well. Like I said, they do prefer, and we, because of the engagement and wanting to see the client and for the client to be able to see us, we do promote phone video sessions, but phone sessions are typically okay as well.
I just wanted to note that I put a resource in the box, kind of in response to that question about, how to help kids find and access resources. So what I included was a web link to Families Together program. Many of you are probably familiar with their work, but they're doing a lot of excellent work with connecting people. What I love about them is that they are statewide. They have a lot of upstate resources, but their staff are people that have been that have been through this system and understand the issues and understand the challenges. So I think they've really developed a helpful approach to this work. So.
Great, thank you. That is all the time we have for questions, I believe. So I'm going to hand it back to Yolanda or Deidre to close us out.
Yeah, thank you so much, Chelsea. And thank you to all our panelists for those great answers and for sharing your insights today. Yolanda, do you want to close us out?
Sure. Thank you again for your questions and being with us today for our webinar on healthcare from our Moving Forward report. A reminder that you can watch all the recordings from the Moving Forward webinars on the FYSA website, and that information will be put in the chat for you. And again, thank you again for attending today's session and for your support of FYSA and the youth we serve. We encourage you to read the full Moving Forward Blueprint report, which is available online. We will also be posting a PDF version of the entire report for download next week. And we ask that you just check back in to the website next week to access that. Thank you very much to our presenters, Timothy, Julia, and Rosita, for being with us today and sharing with us your expertise. And we ask that you just hope you have an amazing day and amazing rest of the week. Thank you.